Welcome to our seminar, Striving to Become an Anti-Racist Department, Strategies for Sustained Engagement and Transformation. Jennifer Egu serves as Vice Chair of Community Health, Diversity, Equity, and Inclusion. Bill Schwab is our current Vice Chair of Education, but was serving as our interim chair from January 2020 to June 2021. Shelley Shaw is our Director of our Office of Community Health. Maddie Batsley is one of our Health Equity Coordinators. Ronnie Hayone is our faculty lead for the AAMC's inaugural LGBTQ+ Fellowship. Tom Hahn is our residency's Associate Program Director, and we are all members of the University of Wisconsin Department of Family Medicine and Community Health. Jordan Bingham and Ananda Murilli are directors of the NINA Collective, a multicultural consulting group advancing institutional racial equity.
We have no conflicts of interest, but recognize that anti-racism work is hard and requires time and money, and so have invested $50,000 to obtain consultative services from the NINA Collective.
Our hope is that this talk will provide a model for assessing the racial climate of an organization and a framework for strategically engaging in organizational anti-racism work. We hope this will inspire viewers to engage in conversation with peers in your own institutions and empower you to discuss opportunities to engage in anti-racism work.
On March 24, 2014, a celebratory email that spanned our statewide department announced our incoming residency class. I took a deep breath and chose to make a bold choice to hit reply all and point out that we just admitted a 100% white cohort, while our school district was only 44% white. Moreover, a recent report showed our county has some of the worst disparities between blacks and whites in the nation. This email spurred a flurry of activity, and soon I would be championing an initiative to rally for a more intentional DEI strategy. Ironically, we would call this the 2020 Initiative, which would lay important groundwork for our 2.0 anti-racism initiative that we would launch in 2020. Notably, this initial initiative was launched at the same time Eric Garner would say his last words, "I can't breathe."
From this initiative, our department's DEI committee was founded in 2015, and we have been doing steady work ever since. For example, we designed a mentorship toolkit that was presented at STFM in 2018. However, the efforts of the DEI committee were largely flying under the radar.
After George Floyd's murder on May 25, 2020, my email exploded with requests to do something. I will note here that over 7,600 unarmed black people had lost their lives to police violence from 2014, when our original DEI initiative began, to 2020. And in fact, after convening members from the STFM Minority Multicultural Health Collaborative on June 3, 2020, we commiserated that we were all being inundated with requests to intervene, and so would write this commentary piece together in the Annals of Family Medicine.
So, in telling this tale, it would be misleading to say that we dived into a new anti-racism initiative headfirst. While we were all overwhelmed by calls and emails, we held firm to the long-term nature of this work. We shared resources with colleagues to help them begin their own journeys, and we spent time with our interim chair considering ways to support anti-racist work in the long term.
So after numerous thoughtful phone calls and emails, on June 18, 2020, our interim chair charged our DEI committee to start an anti-racism initiative and provided the preface for this launch. We can't provide clinical care or teach learners or do research or address community health without having an operational awareness of how structural racism is present and a framework for confronting it. I'm now going to ask Dr. Bill Schwab to share his experience and strategic thinking as a leader that led him to this charge.
I've been asked to offer comments on our initiatives from my perspective as interim department chair at that time, and in approaching that, I want to first speak to the memory of Dr. Beth Potter, who presented at many of these STFM conferences in the past. Beth and her husband, Robin Carey, were brutally murdered 2 months before George Floyd's death. A tireless advocate for social justice who manifested that in many, many ways throughout her over 20 years as a faculty member in our department, her death left a gaping wound within our department and beyond, then and now, that has made honoring her values through this work that much more compelling for me and for all of us. Moving forward with a major commitment to anti-racism while we were in the depth of the pandemic and still in the collective throes of grief as a department was not a simple thing. But, inspired by Beth's memory, move forward through a powerful collective effort we did, and I want to share some leadership principles that were central to me in my role. First, don't just do something, stand there. In the days after George Floyd was killed, I, like everyone else, was filled with distress and with thoughts about what we as a department needed to do. I rapidly heard from many who had strong feelings about actions we should take, with insistence that this must start immediately. And then there were people, Shelley and Jennifer chief among them, who urged pausing and taking time to listen first. It became clear in my view that despite the impatience, we needed to hear from as many voices as possible, and that reflection about how to build a foundation to create meaningful momentum for something that would be enduring was required. In retrospect, the 3 weeks that we paused to gather perspectives before taking first steps was really not that long, but it sure seemed that way at the time. Though it frustrated some, it turned out to be invaluable. Second, sustain the conversation. One of the central jobs of a leader is to set the agenda. If our department's response to heightened awareness of racial inequity was just a statement of outrage, and then nothing was heard from leadership again, this effort would not have had any success. At that time, I was communicating daily with our entire department, over 1,200 people, including our core department administrative teams, clinic staff, learners, faculty, and community preceptors, by sending out a summary of mainly COVID-related information affecting their work, though also encompassing other topics. I added a personal commentary to each. Anti-racism became a central theme for those commentaries. It was something that I made sure was discussed nearly every time at our faculty meetings, staff meetings, residency curriculum sessions, and other opportunities. And the language I elected to use was that we were striving to become an anti-racist department, to convey that this was more ongoing process than final destination, and that commitment would be required over the long term. Third, put your money where your values are. Good intentions are priceless, but that doesn't mean they are cheap. It takes people and time to make things happen. Leaders are responsible for allocating resources to accomplish priorities. That was also not an easy thing at a time of economic challenge when clinical revenues had been drastically reduced because of the pandemic. But we made decisions based on what needed to be done that included redeploying people from other activities and redirecting dollars. I asked our DEI committee to tell me what they needed, and we did our best to provide that. To quote Dr. Martin Luther King, Jr., "A leader is not a searcher for consensus, but a molder of consensus." Listening, communicating, and funding are practical, powerful tools that leaders can use to foster change.
In July, we released a report outlining our recommendations for what we believed would be required to become an anti-racist department. Among the need was to increase our capacity, so we hired the Nina Collective to assist us in further developing and expanding the work.
Our collective is a multiracial consulting cooperative whose mission is that through modeling that another way is possible, we transform, support, and create systems and structures that are built around racial equity. We have been in partnership with the FMCH for about 1.5 years, adopting a phased approach centered on building capacity and leadership. We are in a strong alignment with the department's identified need to unlearn many of our ways of working, that are informed by white dominant culture. We have looked to normalize discussions of race, equity, and belonging, and to support various peoples and teams in the department to apply a racial equity analysis to projects and decisions. In our partnership, we agreed to support visioning and relationship building, assist with organizational assessment, develop diversity, equity, and inclusion, and anti-racism training opportunities, including racial affinity caucusing, and provide advice for ongoing planning and evaluation. Having moved beyond this phase, we continue to support the department by providing ongoing consultation and coaching for specific teams and projects, aid in the development and facilitation of the Racial Affinity Caucus Group, and are looking for ways to measure and evaluate the work that are disruptive of the status quo.
We would now like to share how we assessed our department.
To gauge the needs, attitudes, and experiences of staff, faculty, residents, and fellows in the department, the DEI committee conducted a survey of the department in August 2020, loosely based off a previous DEI departmental climate survey conducted in 2014. Survey results guided the direction of the department's partnership with the NINA Collective. In this mixed method survey, we asked about departmental members' views on race and racism, experiences with belonging and harm within the department, and recommendations for departmental priorities. We also asked demographic questions to better understand if and how experiences and needs differed by race and ethnicity. We were unable to meaningfully compare between our 2014 and 2020 surveys due to significant changes in sampling and context.
Responses to the survey showed a wide range of viewpoints and needs expressed by members of the department. Many participants expressed concern about DEI issues and a need for departmental support of anti-racism efforts, while some expressed a belief that racism did not exist in the department or was not a priority issue. Responses to several key questions differed between white and BIPOC participants.
As expected, overall participant engagement with issues of racism and racial inequality increased significantly after May 2020, but when racially disaggregated, our BIPOC participants were far more likely to engage in these conversations prior to May 2020.
In ranking where participants felt our department was on the multicultural organization continuum, the majority of participants thought we were at a level of structural change, though many still felt we were working in the symbolic change space and still not addressing the institutional status quo of privilege.
When disaggregated by race, BIPOC participants were more likely to rank the department at an earlier phase of the continuum, ranging from level 3, which represents symbolic change, to level 4, which represents identity change.
Ultimately, recruitment was named as a top priority issue across all survey participants, but while all participants felt application of an equity lens was also important, BIPOC members identified racial affinity caucusing as the second highest priority issue.
The NINA Collective expanded the baseline assessment by providing a policy and practice review that covered the domains you see here, including administration, communications, program planning, and aspects of workforce equity. Additionally, NINA pursued rich qualitative input through focus groups and interviews with critical departmental groups, including BIPOC employees and leadership.
From our focus groups, we learned that people felt the department was making anti-racism work a high priority issue, but confounding issues including the high complexity of the large department that bridged multiple institutions with varying identities such as the health system versus the university, the lack of readiness by the leadership, barriers of the current hierarchical culture, and the lack of diversity representation.
From Nina's review of policies and practices, we found some emerging infrastructure to support the anti-racism work, but lack of widespread policies and practices assuring application of an equity lens, historical lack of diversity in leadership, lack of race-explicit language in policy documents and in external communications, a focus on diversity instead of workforce equity, and opportunities for improved community engagement and alignment.
We'll next turn to our strategic framework and current and anticipated plans.
The assessment phase culminated with a set of recommendations that included both short and long-term strategies. Among these were to continue building the infrastructure to support the department's anti-racism work, create an annual DEI learning plan, elevate the voices of BIPOC department and community members, and establish practices for widespread use of racial equity tools in policies and programs.
In the NINA Collective's early work building relationships with the department, NINA directors worked closely with the existing DEI committee to explore a new vision.
In this journey, the DEI committee recognized the need to move from inclusivity to belonging, where diverse voices have not only a seat at the table, but the right to both co-create and make demands of current systems and structures. One example of this is the recruitment working group shifting towards focusing on retention and exploring infrastructure such as mentorship programming as strategies to build belonging.
From this work emerged this new racial equity vision, where the committee felt it was important that everyone feel engaged, included, and had a sense of belonging, a place that reflected the community served at all levels. It was felt that to achieve these, members needed to disrupt and redefine the culture currently defined by whiteness in order to create a new normal.
We have now retooled our mission to include a need to disrupt and redefine our culture that is defined by whiteness and our vision so that we are now promoting not only inclusion but belonging. Our strategies are embodied in the mnemonic trust, transformation, recruiting, unlearning and learning, sustaining and retaining, and tracking and telling. Our visioning work is a good example of the work of transformation. Beyond visioning, transformation requires demonstration of sustained and sustainable commitment to change. Examples our department has undertaken include expansion of our department's Office of Community Health, which supports DEI and anti-racism work across our department, ongoing investment in anti-racism and health equity activities, and diversity in leadership.
While we now have working groups addressing faculty and staff recruitment, our residency has been working on recruitment strategies for years after our departmental DEI committee was formed. We have undergone implicit bias training, have instituted holistic applicant reviews that aim to decrease bias, and have restructured our applicant evaluations. We have also been seeking other forums to recruit residents, such as at the Student National Medical Association annual conference. Now we have enough diversity in our department and residency that we are ready to launch a pathway mentorship program similar to Renee Critchlow's Ladder program. This program, in fact, is being led by URM residents. Notably, our incoming residency class has gone from being 0% BIPOC in 2014 to 50% BIPOC in 2021. The incoming class of 2022 has significantly fewer BIPOC residents, and we recognize that this important work is ongoing, and we remain committed to DEI efforts and residency recruitment.
Since May of 2020, we have expanded the ownership of DEI efforts in our department through a myriad of unlearning and learning opportunities. In 2014, this work was largely owned by Jennifer and members of the DEI committee. Today, we have colleagues across our service areas, from finance to clinical care and everything in between, actively taking part in these sessions, working hard to do their own internal work, and continuing to reevaluate the systems and structures we are working within. As we move into our next phase of work, we are spending more time in coaching and consultative sessions with members of the NINA Collective. Our HR colleagues are reaching out as they reconsider recruitment strategies as one concrete example. I have personally reached out for coaching on ways to create spaces for mistakes in this often very hard and complicated work.
As we move toward strategies of belonging, our faculty and staff recruitment and retention working groups are now intentionally focusing more on issues of retention, as well as exploring infrastructure, such as mentorship programming, as a strategy to promote belonging.
While we have a data dashboard in place, we are now working to establish metrics more directly related to our vision statement and trust values. We also have greater expertise in our Office of Community Health, from community organizers to participatory-based community researchers, and thus anticipate not only greater evaluation and scholarship of our efforts, but centering of community voices to further shape and nurture this work.
To help communicate our multi-level approach, we applied a socio-ecological framework to show the need for individual, interpersonal, and systems-level strategic engagement, which we believe is necessary to assure meaningful and sustainable change.
Here, you can see how all of our current strategies fit into the socio-ecological model. I'd like to highlight some strategies we are focusing on in the context of this SEM, based on survey results, focus group feedback, and the NINA Collective's baseline assessment. Within the individual level, leadership training and other courses provide anti-racism learning opportunities for staff and faculty to build capacity so we can all own this work together. At the interpersonal level, we are implementing racial affinity caucusing opportunities for BIPOC and white people. There are many other activities at the policy and systems level that we are working to approach through partnership with HR, leadership, and campus partners that are not within the scope of our DEI committee alone, such as equitable recruitment and applying an equity lens to our departmental policies and practices. We are working to measure impact through tracking and evaluating our strategies, as previously mentioned. It is important to note that the complexity of our departmental structure has required foundational work by the DEI committee to set the groundwork for all of this programming, including increased staff and faculty capacity dedicated toward DEI work, accomplished in part through growing our Office of Community Health.
While this remains a work in progress, we hope this stimulates ideas and strategies for you to consider as you support your institution in engaging in anti-racism work. As fellow educators, we leave you with the words of Bell Hooks. The academy is not paradise, but learning is a place where paradise can be created. The classroom, with all its limitations, remains a location of possibility. In that field of possibility, we have the opportunity to labor for freedom, to demand of ourselves and our comrades an openness of mind and heart that allows us to face reality even as we collectively imagine ways to move beyond boundaries, to transgress. This is education as a practice of freedom. Thank you.